Hi, this is Laura from Train to Respond. In the wake of what happened yesterday in Michigan and the horrific attack at the LDS Church, I wanted to come on here and just speak about three different things that I think all houses of worship should consider doing at this point. Number one, have some type of security team that trains together, armed if possible. I know that will vary from state to state, whether you can have your parishioners be part of the armed security, as we've seen in Michigan, who actually stopped a threat a number of weeks ago as they were coming in with a long gun. And the armed parishioners were actually able to shoot them. You may bring in law enforcement as well to be your security team. It just depends state to state what your laws are as to according who can carry and who could be on that armed security team. But number one, an armed security team that trains together and practices. Number two, train a team as immediate responders, which means these are people who will step up to help those who are wounded in the aftermath. I teach around the country. You can go to my website, traintorespond.com, to learn about the training that I do. But you have people in your area. You have stop the bleed instructors. You have your EMS departments, your fire departments. And I know that they will be willing to step up and train their local churches, their local houses of worship, whatever it may be, synagogues, mosques. You all need this training. So train people to be immediate responders, which means you have a team of people who are going to step into action, and you've given them equipment to do that. So this is what I recommend for any of the groups and corporations that I train. This comes from North American Rescue. It is a full kit. It has a pressure bandage. It has a combat application tourniquet. It has a blanket that you can put over folks who are bleeding. Very important to keep people warm. It has chest seals to put on. It has gloves, has wound packing gauze, and it has a pen to write on the time of the tourniquet application. This truly saves lives. To have people trained that can go into action and save people's lives. Because who do you think, I always say this in all my classes, who do you think is actually going to save lives in the immediate moments after the attack? You can bleed to death in your leg, a femoral artery, in under a minute. So who's going to save lives? The first responders are on the way. But the people that are going to save the lives are those trained as immediate responders. And then number three, do active threat, active shooter drills with your parishioners, with your worshipers. It could be after you have your service. Say, okay, today we're all sticking around and we are going to do a drill. Have the security team do their thing. Have the immediate responders step up. Have a few people that are wounded. Let them get into action and practice. Tourniquets and all of this stuff are perishable skills. If you don't use it, you lose it. And you may say, well, you have doctors and nurses that attend, but not every doctor or nurse is trained in how to do things in an emergency basis. As paramedics, EMTs, firefighters, emergency room docs, nurses, trauma docs, nurses, we are trained in how to use all this equipment and quickly jump into action. So just because you have doctors and nurses there does not mean that they know how to use a tourniquet. So train everybody. And if you have doctors and nurses there, phenomenal. If you can train them in how to use this equipment, wow, that's great. You have medical professionals on staff. Please consider these three things. Armed security, a security team. Two, training your people as immediate responders and giving them the equipment, whatever it may look like, that they can hop into action. And three, doing active threat drills with your worshipers and parishioners so that you can hop into action when things happen. We have to just stop pretending that the world is going to go back to what it once was when I grew up in the 70s, 80s, and 90s. It's not. The new age of violence is here. And I hate it. I absolutely hate it. I don't even recognize this world, and I'm sure many of you feel the same way, but this is how it is. All houses of worships need to be trained, have their teams, and be ready to take action should something happen.